Good evening, I'm Daniel Brown, and welcome to Latest Global News TV. Tonight, we bring you a story of immense global significance. Reports from China indicate a disturbing trend. The country is grappling with multiple pandemics, while an alarming number of healthcare facilities are shutting down. In just 1 year, more than 500 hospitals across China have ceased operations. These closures come at a time when robust healthcare infrastructure is critically needed. The question on everyone's mind is, why? Why are these hospitals shutting down? And what does it mean for the country's ability to combat the spread of infectious diseases? Even more puzzling is the silence surrounding this issue. Despite the grave implications, this story has received minimal coverage in international media. We'll take you to exclusive footage and first-hand accounts, delving deeper into this unfolding crisis.
I'm honestly speechless. I don't know if the hospital has worn me out or if I've worn out the hospital. I'm about to lose my job again. I was struggling with whether or not to resign, and then I heard a rumor that our hospital is about to close. The first hospital I worked at after graduating was a private one. I worked there for 2 years, but when the pandemic hit, it shut down. Then I moved to another private hospital. In the first and second months, things were going well, lots of patients, good pay, and I could earn around 4,700 to 4,800 yuan. By the third month, suddenly there were no patients. The hospital gradually started losing money, wages were delayed, and eventually everyone left. Then I found my current job at a public grade 2A hospital, but with healthcare reforms, my salary was cut by more than 2,000 yuan a month, and now today I received news that it's about to close too. Am I just incredibly unlucky, or is the job market really this bad right now? Luan Tumor Hospital has gone bankrupt. This is truly unbelievable. Many hospitals are facing closure and medical staff can't even receive their wages. How could this happen? I'm not sure about other places, but in my area, upstairs, downstairs, neighbors, all around, it feels like everyone is sick. There's hardly anyone who isn't, and yet, aside from hospitals, there are barely any people in the streets, malls, or supermarkets. Why are hospitals still going bankrupt? Why can't medical staff get paid? A blogger shared a video of an empty hospital after its closure, writing, "I'll always thought I'd work here until retirement. Who knew that overnight everything would change? For a while, I believed things would return to normal, but ultimately, reality proved otherwise. In the end, we couldn't escape the wave of hospital bankruptcies. Let's bid farewell properly. Hopefully, the next stop will be the final destination." From late 2024 to early this year, influenza, human metapneumovirus, and rhinovirus spread simultaneously across China, overwhelming many top-tier hospitals. Outpatient and emergency departments saw significant surges, straining medical resources, yet many hospitals had already shut down in advance. Vice President of the Private Hospital Management Branch of the Chinese Hospital Association, Yu Xiaobao, noted that since the outbreak of the pandemic, over 2,000 private hospitals have gone bankrupt due to operational difficulties. This number continues to rise. According to official Chinese government data, the loss rate for both public and private hospitals nationwide has remained around 45%. In other words, nearly half of the hospitals in the country are operating at a loss. In 2024 alone, more than 500 hospitals closed, primarily small and medium-sized private hospitals. Many of the private hospitals that have closed down either suffered from poor management and heavy debt or were impacted by policy adjustments and sharp reductions in subsidies, plunging them into developmental difficulties. However, public hospitals are not as secure as one might imagine. In recent years, reports of delayed wages have frequently emerged from public hospitals across various regions. Take the affiliated hospital of Jiaying University School of Medicine in Meizhou City as an example. The city-level public comprehensive Grade 2 hospital announced the suspension of operations and notified staff to resign in October 2024 after 10 months of wage arrears. Staff from the Meizhou Health Bureau responded to media inquiries stating that the hospital was applying for bankruptcy. Currently, public hospital revenues in China mainly consist of payments from the Medical Insurance Fund, patient fees, and financial subsidies. The Medical Insurance Fund now accounts for more than half of public hospital income. Data shows that the hospital's medical income in 2023 was 31.6 million yuan, a decrease of 12.2 million yuan from the previous year, marking a 28% drop. The hospital's expenditures primarily include personnel costs and project expenses necessary to maintain normal operations. In 2020, the hospital undertook upgrades to outpatients and inpatient buildings with an estimated total investment of around 71.5 million yuan, representing a significant expense. The fiscal situation of Meijiang District, where the hospital is located, is far from optimistic. Data shows that from January to September 2024, Meijiang District's general public budget revenue was 482 million yuan, a decrease of 33.5 million yuan from the same period the previous year, reflecting a 6.5% drop. Similarly, at public hospitals such as Shanwei People's Hospital in Guangdong and the 4th People's Hospital of Xinxiang in Henan, long-term wages arrears have driven medical staff to stage protests. Healthcare workers unfurled banners and shouted slogans within hospital premises to express their dissatisfaction and demands, seeking the respect and compensation they deserve. On October 16, 2024, over 100 medical staff staged a collective strike in the Shanwei People's Hospital lobby over unfair bonus distribution. Online videos showed them holding blank sheets of paper with the words "I need to eat" and chanting slogans such as "Director, come out and give us our bonuses." But is the widespread closure of hospitals in China solely due to tight financial conditions and local fiscal strain?
你敢相信吗?
Can you believe it? You wake up and the sky feels like it's falling. Another industry is starting to collapse. If you say schools or banks are shutting down, that's no longer surprising. But hospitals? It seems unbelievable, but it's true. Right now, there are two places filled with people: supermarkets and hospitals. Both are places where people line up to spend money. Yet somehow, the wave of bankruptcies has hit hospitals. Believe it or not, it's happening.
A vlogger analyzed the situation in a video explaining.
Let me tell you something even harder to believe. 62.5% of hospitals are currently operating at a loss. After hospitals close, medical staff begin to disperse. A few years ago, a major grade 2 hospital in our area also suddenly shut down. You might not believe it, but 50 to 60 years ago, that hospital was the most prominent landmark in our community. Yet in recent years, many hospitals have quietly closed down, and even more will follow in the future. This means a large number of doctors and nurses will face unemployment. Public hospitals may seem like stable jobs, but even those positions are no longer as secure as they used to be.
The blogger explained that hospital revenue in China comes from two main sources: financial subsidies and hospital-generated income, which essentially means profit from medication sales and treatment fees. However, China has now entered a phase of severe population aging, and the demographic dividend is gone. The funds in the medical insurance pool are insufficient. For non-self-paying patients, the government strictly controls hospital charges. Medication prices are kept low, and so are profits. At the same time, many hospitals are expanding and renovating. Historically, periods of decline often start with large-scale construction, and hospitals are no exception. After building new facilities and upgrading interiors, hospital funds are often depleted. When difficulties arise, closures follow. Even hospitals that haven't gone bankrupt are struggling. One blogger noted that salary cuts are just the beginning. Layoffs will dominate 2025. Another medical vlogger shared.
Let me tell you the truth. Salary cuts are just the start. Layoffs will dominate 2025. Many healthcare workers will lose their jobs, and hospitals have already begun listing names. It's ironic. Hospitals, meant to save lives, now resemble political dramas. During the 3 years of COVID, you were needed. Now it's you who face pay cuts and layoffs. It's disheartening. Layoffs and salary cuts will become the norm, and based on current policies and realities, this situation is far from over. Why? Because the wave of hospital losses hasn't fully hit yet. Since the pandemic began, hospitals entered a frenzy of expansion, especially general and traditional Chinese medicine hospitals. New projects increased by 1.5 times compared to previous years, and new hospital buildings sprung up rapidly. But many hospitals overlooked the operational costs behind such expansion. Official data shows that in 2024, 62.5% of hospitals are in deficit, and the situation in 2025 will likely be worse. The after effects of reckless expansion are beginning to surface. Salary cuts stem from this. With policies like centralized drug procurement and reforms taking full effect, hospital insurance income is tightening. Meanwhile, the cost of medical services hasn't decreased, and the actual patient volume hasn't grown. As a result, equipment, staff, and hospital beds have become empty shells, making salary cuts and layoffs inevitable. Healthcare workers are at the bottom of the food chain. Dismissed with a simple excuse like recent hospital expansion has led to debt that can't be repaid, causing delayed or withheld performance bonuses. Even if higher authorities investigate, nothing violates regulations or laws. It's just procedural. When top-level policies tighten, everyone below follows. Hospitals are expected to cut costs and increase efficiency, reduce staff, and streamline operations. If salary cuts aren't enough, layoffs follow. Tougher times are ahead. That's just how it is.
Some netizens share their experiences. We haven't received our performance bonuses for 6 months. Just 2 days ago, we finally got the bonuses for August and September. 2 months of holiday pay totaled around 4,000 yuan. Our hospital hasn't issued the 13th month salary or heating allowance yet. I work at a newly upgraded Grade 3 Class B traditional Chinese medicine hospital, exactly the type of mid-level hospital the vlogger mentioned. I can't even find a job. Hospitals only hire people under 30, and now that I am in my 30s, I don't even qualify to apply. It's the same here. We haven't been paid for 7 months. Hospitals are packed with patients every day. How could they possibly go bankrupt? It's not as simple as you think. If the situation continues, patients with money still won't be able to get treatment. Doctors will end up paying out of their own pockets to treat patients, and most nurses will be inexperienced to completely new. It's disheartening. My spouse and I both work in the medical field. We're still getting paid on time for now, and although performance bonuses have decreased, they still exist. But with all the pay cuts happening around us, we don't know how much longer this will last. I work at a fully public Grade 3 hospital with no private sector involvement, and even we've started holding meetings about layoffs. Everyone knows that hospital closures stem from financial difficulties, but this issue has accumulated over the long term due to systemic problems. Healthcare, education, and housing costs in China consume a significant portion of the average person's income, greatly increasing the financial pressure on citizens. Among these, medical expenses are like a bottomless pit. During an interview, renowned Beijing pharmaceutical scholar Professor Li Ling revealed that their research showed that if China had implemented universal healthcare years ago, it would have required 800 billion yuan. Now, medical expenditures have surpassed 9 trillion yuan. Yet people still find it difficult and expensive to access healthcare. According to her statistics, Chinese citizens currently bear around 50% of the total medical cost. In contrast, Western countries with universal healthcare typically see governments covering over 90% of expenses, leaving individuals to pay less than 10%. Over 100 countries worldwide have adopted universal healthcare, and the Chinese government has the financial capacity to implement it, but hasn't done so. Professor Li believes that China's healthcare system is highly chaotic, with one of the main reasons being that government funding accounts for only 8% of hospital income. Hospitals must earn the rest themselves, leading to excessive tests and unnecessary prescriptions to maximize profits. Public hospitals are not truly public welfare institutions, but fully market-driven entities prioritizing profits, resulting in widespread disorder and corruption. Many head physicians reportedly possess assets worth over 100 million yuan. According to Chinese media Shouhu, 95% of hospital equipment in China is imported, often costing millions or even tens of millions of yuan. The main import sources are the United States, Germany, and Japan. Annual hospital equipment procurement can cost billions of yuan. However, hospital management is riddled with corruption and large-scale bribery involved in equipment purchases. State media reported that digital angiography system purchased by a hospital had a production price of 5.79 million yuan, but the hospital bought it for 11.7 million yuan, double the original price. A US-made Doppler blood flow imaging system was sold to the hospital for 980,000 yuan, with the hospital director receiving a kickback of 100,000 yuan. A Korean-made 3D multifunctional color Doppler ultrasound machine was sold to a hospital for over 1.6 million yuan, with 300,000 yuan going directly to the hospital director as a bribe. Since 2023, the government has launched an extensive anti-corruption campaign targeting the healthcare sector, confiscating illicit assets and investigating numerous officials and hospital leaders, both active and retired. Government data shows that by 2024, over 320 officials from the medical and healthcare sectors had been investigated, including more than 160 hospital directors or secretaries. In one case, Wang Maoshen, the director of Gaozhou People's Hospital in Guangdong, received over 200 million yuan in bribes over the years. In China, when a leader of an institution is implicated, the entire financial situation of the unit is scrutinized. Hospitals are often forced to repay previously earned funds, significantly impacting their operations. However, the money reclaimed by the central authorities rarely returns to the hospital. Instead, it benefits the upper echelon of the political elite. In 1995, U.S. National Academy of Sciences member William Shao led a team of experts to help Taiwan design its current universal health insurance system, providing free health care for all citizens, something many in mainland China envy. However, under the CCP rule, replicating Taiwan's model in mainland China remains impossible. Shao noted that Taiwan already had a comprehensive healthcare system with a solid foundation of family doctors. The entire system was not designed to generate profit, and the moral standards of doctors remained intact, allowing for the successful implementation of universal health insurance. Financial transparency also ensured the system's sustainability. He stated that replicating this model in mainland China would require political will and 1 or 2 decades of effort. However, the CCP's lack of emphasis on public healthcare, coupled with unequal resource distribution and corruption within the medical profession, has exacerbated the issue. China's healthcare resources are unevenly distributed between urban and rural areas, and there is significant inequality in access between the privileged class and ordinary citizens. High-level officials' exclusive hospital wards in particular have drawn widespread criticism. Shao remarked that this is a political mechanism of the Communist Party's governance copied from the Soviet Union. It's fundamentally an unfair practice. Regarding the CCP's large-scale anti-corruption campaign in the medical sector, Shao commented that the root of the issue lies in the systemic moral corruption, and such campaigns provide only temporary relief. He said that the ethical principle of medicine is to serve the people and treat patients with reasonable and effective methods. In China, the problem is that both doctors and hospital administrators are driven by profit. In reality, as China's economy has declined in recent years, industries across the board have suffered. It's not just hospitals. Kindergartens, primary and secondary schools have shut down, numerous small and medium-sized banks have been dissolved or merged, while the restaurant industry has faced widespread closures. Even China's still enterprises have seen massive bankruptcies. In October 2024, Taiwan's Mainland Affairs Council released a quarterly report on mainland China, noting that nearly 2,000 county-level television stations, long reliant on government fiscal support, were facing closure due to operational difficulties. Independent commentator Du Zhen stated that this is not a localized economic crisis in China, but rather a manifestation of the systemic collapse of China's political, economic, and social structures. He emphasized that the root cause of the issue is the rigid and authoritarian nature of the CCP system. When the economic environment is favorable, the system appears glamorous, like a nouveau riche, but when conditions deteriorate, the system reveals its deep-rooted problems, which are incurable.
We aim to uncover the truth behind the healthcare collapse, its potential causes, and its far-reaching consequences, as we investigate why this dangerous story remains underreported, and what it might signal for global health security. And that brings us to the end of tonight's broadcast on Latest Global News TV. As always, we're committed to keeping you informed with accurate, timely reporting on the stories that matter most. Be sure to like, subscribe, and hit the notification bell so you never miss an update. I'm Daniel Brown, wishing you a safe and peaceful evening. Thank you for watching, and we'll see you next time on Latest Global News TV.